Good afternoon, everyone, or good morning to those of you calling in from the West Coast. I am Tracy Duberman, the President and CEO of the Leadership Development Group. I want to welcome all of you to our Leading Across the Healthcare Ecosystem Virtual Leadership Summit, aka webinar today. First and foremost, I would like to express my sincere appreciation to Lisa, the entire TLD Group leadership team, our panelists, and our moderator for their individual and collective contributions in making today's webinar a reality. I am confident that the next 90 minutes will provide for you, our participants, meaningful insights and practical strategies for developing the capacity for leaders in today's healthcare environment. We have a packed agenda intended to cover the learning objectives outlined on this slide. Following brief introductions, our moderator, Bob Sachs, will define what we mean by and why it is critically important to take an ecosystem view of healthcare. We will then engage our panelists to share their experiences, successes, challenges, and key learnings in three main areas to include working across sector to achieve favorable health outcomes, developing healthcare ecosystem competence, and finally, a how-to in terms of applying ecosystem solutions to resolve local sector problems. Next, we'll examine the healthcare ecosystem leadership model, otherwise known as Leading from the Helm, our acronym for healthcare ecosystem leadership, as well as strategies for development. Throughout the webinar, we will ask several polling questions to you to enable Bob and the panelists to tailor their responses to meet your most pressing needs. And as Lisa mentioned, please do not hesitate to raise a question by submitting it through the webinar taskbar under the tab labeled questions. With that as a backdrop, I'd like to actually initiate the first polling question. So just take a moment, please, to provide for us the sectors that you represent. All right. Okay, we've got a nice response rate, so I'm going to put the results up on the screen. And as you can see, we've got a variety of different sectors represented here, mostly coming from the provider area. And then we've got a host of other folks coming from all other areas, as well as from representing the entire healthcare ecosystem. So this is very encouraging, and we're excited to get to know strategies for success within each one of these sectors, and then of course across sectors. Okay. Okay, so I'd like to just briefly introduce myself before handing the microphone over to Bob and the panelists. For those of you that are new to the Leadership Development Group, we are a global talent development firm. We develop healthcare leaders and medical and scientific executives across the ecosystem to execute strategy, and we do so through tailored solutions, including our educational workshops, leadership development programs, executive coaching, and consulting services. Bob?
Thanks, Tracy, and good morning or afternoon, everybody. It's a pleasure to be here. I think you can see from what's up on the screen, I retired from Kaiser Permanente in December of last year, And since then, I've had the opportunity to work with Tracy and her organization as a member of her advisory board, and also on some of the concepts that you'll be seeing and hearing about today. So I'm really looking forward to talking with the panelists and all of you and moderating today's panel.
Thank you, Bob, very much, and we're so excited to have you on our advisory board as well. Next, David.
Yeah, hi. It's a real pleasure to be here with you today. My name is David Carmouche. I currently serve as the president of the Ochsner Health Network. It's a large, statewide, Louisiana-based, simply integrated network that's anchored by the Ochsner Health System, where I serve as a senior vice president. Prior to coming to the Ochsner Health Network, I was the chief medical officer and executive vice president over external health plan operations for Blue Cross Blue Shield of Louisiana. So my experience spans the provider sector, the payer sector, and certainly we've had interactions, and I've been at the table with pharma and other sectors in the ecosystem, so I look forward to the conversation today.
Thank you, David, very much. And next to Ira.
Thanks, Tracy. This is Ira Klein here. My present role is as the lead in quality strategy for the J&J Healthcare Systems Group. And I've been in that role for about a year, and I find that very exciting. New to the pharmaceutical industry, but previously had 10 years at Aetna in a variety of roles, including chief of staff and national medical director leading oncology strategy. I've had some experience, 3 years in the health system world, but primarily in the clinical world, starting out in academics, and then in the insurance world, now learning another part of the ecosystem. So I'm very excited to be here, Tracy.
Thank you, Ira, very much. And last but not least, Elliot.
Hi, Elliot Levy. I'm the head of global development at Amgen. I'm responsible for late phase clinical research. Trained as a nephrologist, began my career as an academic physician, and have spent the last 20 years or so in the pharmaceutical industry in research and development. And I have the good fortune to work on a number of important new medicines, including Orencia for rheumatoid arthritis, new logics for transplant, Eliquis, Corlenorm, cardiovascular disease, and Yervoy, Imlygic, Blincyto, and Caprolis for malignant disease.
Thank you. Thank you, Bob, David, Ira, and Elliot for introducing yourselves. And I'm sure the participants are just as excited as I am to listen to your experiences and have Bob take us through our research. So, Bob, I'll hand the mic back over to you.
Great. Thanks, Tracy. Let's get started. And I think a good place to start is why we even thought this theme of leading in the healthcare ecosystem was an important one, and kind of set the stage for the conversation. You can see a slide up in front of you picturing a tsunami, and given that all of you on the call are part of healthcare, good percentage of you are in the provider side. I don't need to spend a ton of time talking about just how the industry that we all operate in has become. It's a function of care continuing to be more expensive than the nation and people, payers who are paying the bill can afford. Changing and shifting government regulations intended to deal with some of that issue of cost and access. Technology continually changing, providing more opportunities to treat, but also adding to the expense side of the change in many cases. And all of this in a context of demand growth as the population ages, chronic disease continues. So it is really kind of a tsunami or even a perfect storm of change in population that says we really do need to think differently about how we go about dealing with this business of healthcare. And I think a big focus of this really comes down to the idea that we really need to begin to think about focusing on health, of which healthcare is part of. But actually, when you look at the things that determine whether or not people and populations of people are healthy, the care that we provide is actually an important but relatively small percentage of things that impact whether or not we have healthy populations. And more the ecosystem really needs to begin to deal with how we keep people healthy, which requires more and more players to work together. And that's a lot of why this presentation was put together today. And as we begin to shift from payment systems that are from volume to value, and as we try to begin to find ways to better align incentives across these different sectors around health and better health care, the leadership demands are continuing to go up. And so that's kind of the environment that we're in. And I think one question we might want to then ask yourself is, well, why is an ecosystem approach important given all of what we said? And you see some things listed here, and all of these things are critical in responding to the market forces. The whole idea of keeping consumers healthy and having that be the center of what we're trying to accomplish is critical to really, again, dealing with these various forces. In order to do that, we need to create connections and dialogue across sectors, across stakeholders that don't happen through the normal course of business. And an ecosystem view done well should help us to do that. It also provides an opportunity to deal with the tensions and conflicts that will happen between sectors, whether it's providers and payers, whether it's physicians and hospitals, whether it's the pharma and clinicians. There are differences that need to be worked through, and the ecosystem view gives us an opportunity to think about how we're going to handle things better and more effectively, which in turn will lead us to create more innovation and solutions that are not possible when we try to work more separately from each other. And so the ecosystem view is important for all those reasons, again, given the forces that we are all facing. And so let's go on and just get a little bit more clear about what it is we mean by the healthcare ecosystem. And you can see, a definition up there. And some of the important concepts here is this is a very diverse set of sectors, and it's diverse in the sense of having different interests, values, points of view, and at the same time they are interdependent in having a shared interest around improving health in our population and improving people's quality of life. And so the challenge is really how can we capitalize on that shared interest while at the same time optimizing the individual interests that each organization or sector has. And that really requires each of the players to begin to think about what's most critical to them, what's perhaps less critical, and what kinds of things can we do differently in order to create this shared interest. And by doing that kind of balancing and leveraging, there's really an opportunity to begin to create a different system of health than what we've been able to do when we've tended to operate more in our different sectors independently. And it's one working as that ecosystem that we really have the potential to deliver some real value and meet some of the critical imperatives that the industry is facing. And if we go to the next slide, you'll see some of those imperatives listed. And again, being able to be much more focused on our patients and our consumers as kind of the crux of why we're all here. The ability to begin to manage populations, particularly from a health standpoint, and then to be able to deal with them effectively as people need care. To be able to reduce the total cost of care, which again begins with having people not needing care as frequently or being able to stay out of chronic conditions for as long as possible, or to have chronic conditions not move into acute conditions. These are all things that can help us reduce our cost In order to do that, we have to continue to find ways to improve coverage so that everybody has access to care. Because high-quality care that isn't affordable or people don't have access to doesn't do anybody any good. We're going to have to learn how we optimize these value-based pay models. And again, the ecosystem can help us to do that. And how do we leverage technology, not just within sectors, but across sectors as well. And so these are things that we need the ecosystem to take on. But again, I think the premise of today's discussion can be done more effectively from this broader perspective than if we were to tackle it in each of our individual sectors. And ideally, if we can imagine a world where, again, the patients, the populations, the people that we all serve are in the center, and that what we're trying to do is begin to find what kinds of things stand in the way or are challenges for them either staying healthy or getting the right care, and so that we can begin to focus on maintaining, improving, and restoring health, and doing that as an integrated system of providers, pharma companies, medical device companies, policymakers, government agencies at the national, state, and local level, technology community, community agencies, safety net organizations, all focused on this idea of how do we make sure that we have people who are healthy, getting healthier, and are returned to health when that's the necessary approach. So that's, imagine if we were all working toward that purpose. And so there's a very much of a what if kind of design thinking view to what this ideal state could potentially look at. So what does leadership mean in this, and what is the context in which leadership needs to operate? I think you'll find as we go through some of the discussions today, and as you see the leadership model, that some of the capabilities that are called for are skills that show up when people work within an organization. Anyone who works in a large organization is going to find different points of view, different perspectives within their organization, and those that are successful at working across those really have a leg up on beginning to be able to work in the ecosystem. At the same time, the complexity of working when those values are different, when the incentives are different, when the metrics are different, when the culture are different, the complexity of being able to work across those differences, that degree of diversity, and creating conditions for success goes way, way up. And so it's really how do you take competencies and capabilities that perhaps have enabled leaders within an organizational context to move those up and spread those across a much more complex environment where there is less of a shared history, less shared values, and perhaps even less of a shared mission. And in doing that, leaders need to do certain things to create conditions for success. And you can see these listed here. And again, when you think about the kind of vision that we're talking about, it is that what if vision. What if we all work together in a different way? What if we were able to engage each other in working towards some common vision? And that creating that vision and engaging others in that vision becomes critical as the diversity of players goes up. It also becomes more difficult. It becomes critical that we, as we begin to work together, that we actually develop ways, different models, different forms of collaboration that will enable us to meet this common purpose of healthy populations. And it's going to require some changes in our own systems so that the systems and the processes that we use within our own organizations have a good interface with the appropriate touch points in other stakeholder organizations that we're trying to work with. And we're going to need to have employees who understand how to operate in this larger environment. So we're going to turn it over to the panel in a moment, but before we do that, I know that Tracy has another polling question for folks.
I do indeed. We're going to launch the second poll. Okay, we'll give it a couple more seconds. Okay, I'll close the poll now and share the results. It's interesting to me to see that over 50% of our participants are thinking from an ecosystem perspective in terms of their strategy. I think that's very, very encouraging. Less than 20% is where it's really driving strategy. So with that as a backdrop, I'll turn the mic back over to Bob to engage our panelists in this discussion.
Great. Yeah, and it is encouraging to see that so many of the folks on the call today do see working in the ecosystem as part of their strategy. As I know, the folks on our panel have been part of that, and we want to engage them on what they've found has worked effectively in that. And so you can see the question here about when someone in your organization has worked across sectors. And so we're going to hear from our panelists, and why don't we start with David?
Yeah, thanks, Bob. I think, you know, as I was kind of thinking about this question, the work I did at Blue Cross Blue Shield really kind of came to the forefront of my mind. You know, when I was at Blue Cross, I think it was a time where this payer organization, which controls about 70% of the commercial market in Louisiana, was starting to grapple with the notion that post-ACA, the ability to healthcare costs was a set of activities that largely existed now outside of the sector of the payer alone. The payer was not going to be able to do that. And I was brought in specifically to kind of bridge the gap between providers and payers in our state. And as we looked around at the population of Louisiana, we saw a few things. Number one, it's a very unhealthy state, 49 or 50 in health outcomes. It's a rural state, relatively poor. The providers of primary care in our state were largely unorganized, independent, small family practice and or internal medicine practices across multiple sites, many times without electronic medical records or significant infrastructure. And we started to think, how would we as a payer change the relationship with our providers to create programs that supported their ability to care for populations and rewarded them for that. So we really, in a multi kind of sector way, sat down and designed a program that had the support of the Family Practice Academy in Louisiana, several hospital-based systems. We called it Quality Blue Primary Care, and it was a voluntary program that within its first year had 700 primary care doctors across the state participating in it. And within this program, our mindset was, first of all, the health plan has resources that we can invest, number one. Number two, we can do that as a way to strengthen our relationship on behalf of our members. Number three, we could support primary care doctors and allow them to remain independent and allow them to be happy and productive and manage populations. And so we saw lots of wins, and it involved us creating an IT infrastructure whereby we were able to connect to electronic medical records and provide access to claims data and pharmacy claims data and pull in clinical data from EMRs to populate registries. Those registries did a couple things. Number one, they were, in many cases, the first time any of our providers in the state had access to health registries. Second, our care coordinators and our care managers that were FTEs hired by Blue Cross were able to see the same registries and actually were able to do care coordination and outreach, pre-visit and post-visit contact on behalf of providers, so that providers were not asked to hire new FTEs. We were also able to then pull clinical data directly from the EMR to understand quality and performance, and we rewarded performance by and supported this program by attaching care management fees to patients who were attributed to these primary care physicians who had chronic diseases. And these were monthly payments that were tiered based on the burden of disease, number of chronic diseases, but also tiered based on performance. So the providers who did a great job we're actually able to make a significant amount of money in providing outstanding primary care for patients with Crohn's disease. And so this was a really important program for Louisiana. At the end of the first year, not only had it substantially improved quality across the common diseases, hypertension, diabetes, chronic kidney disease, and cardiovascular disease, it also had reduced the PMPM total cost of care. Net of all the expenses that went into funding this program, we were able to reduce healthcare costs by about $25 per member per month just within 1 year. So I think that's a great example of a payer sector having a vision for trying to improve the health of Louisiana, engaging the provider community across the state, making the right investments, driving the right message, and actually ultimately delivering true value to the patients that live in Louisiana. So I'd say that's the one that rings true for me.
Great, thanks, David. Great example. Ira or Elliot, maybe we could ask one of you to speak more from a perspective of pharma and how this might look from a farmer perspective. So maybe Elliot, why don't we see if you've got an example that you'd like to talk about?
Well, maybe I'll talk about my work with the Clinical Trials Transformation Initiative, or CITI. CITI is a public-private partnership that was launched by the U.S. Food and Drug Administration about 8 years ago, with the intention of improving the quality and efficiency of clinical research. And those who founded it recognized that there were many clinical questions for which answers were lacking because there was insufficient data, but the cost of gathering clinical data was a significant obstacle to filling those evidence gaps. And that if we could find ways to conduct clinical trials that were more efficient without sacrificing quality, that we could increase the amount of information available to physicians and patients in order to make clinical decisions and improve outcomes. CITI is an organization with about 80 members, spanning all dimensions of clinical research, ranging from the U.S. Food and Drug Administration and other major regulators to regulated pharmaceutical and biotech industry, device industry, academic medical centers and academic investigators, patient advocacy groups, and professional societies. Extraordinarily broad membership with a common focus on clinical research and a strong belief that if we found ways to simplify it, we could do right for patients. So I'll mention one project that we launched, which was to look at the process of on-site monitoring. This is a process in which individuals go out to the investigative sites and review the data that's being collected there to ensure that it correctly reflects the experience of the patient. It's a process that everyone recognized was time-consuming, expensive, and contributed a relatively modest amount to the quality of the study. Working together with representatives from all the different sectors involved in clinical research, the FDA was able to develop a consensus position reflected in subsequent guidelines that offers a path forward to sponsors of clinical research to change the way that they approach site monitoring, to reduce the cost, and then to rededicate those resources to answering important clinical questions. So for me, it was a great example of how organizations with very different missions could work together to solve a common problem and improve healthcare in the country.
Great, thank you. Thank you very much. So I'm sure we could spend more time on this question, but why don't we move on to the next question, and maybe as you'll see when it comes up here, that it really talks about understanding the value of other sectors and really being able to partner effectively. Starts off with recognizing and understanding something about those other sectors. And maybe, Elliot, you could talk a bit around this question about how in your role and some of your roles in the past you've gone about trying to build your understanding of how the other sectors could contribute to what you're trying to do and how you might be able to work together.
Well, I think probably the most important thing is to actively seek out people who don't work in your sector, try to understand what the world looks like to them, that you have to be prepared, I think, to expend substantial time and energy to understand the perspective of different sectors, different organizations. About 7 years ago, I led a project to develop a new kind of relationship between our research and development organization and a number of the contract research organizations who carry out clinical research on our behalf. Historically, we had sent about 1/3 of our clinical trials out to these contract research organizations. Our relationship with them was very tactical. We'd contract with them study by study. We'd typically bid out the studies to 3 or 4 companies and then go with the lowest price provider. We envisioned a different sort of relationship where we'd have 1 or 2 partners that we work more closely with. We'd work together with these partners to identify a common book of work looking out over a 3-year period that would allow them to plan their workforce allocation to meet our needs, to build capabilities if they needed special capabilities in order to work with us. And it would allow us to also partner together to develop improved ways of working, continuous improvement to up the quality of our work. So in order to prepare for this, we spent about 3 months conducting a very deep exploration of the mission and the economics of our potential business partners, so that when we sat down with them to strike a partnership, we could make it a win-win partnership based on a kind of clear-eyed view about what was necessary for us to succeed, but also a deep understanding of what would make the partnership work for them. So that's I want to stop to give other people a chance to talk as well.
Bob, you may be on mute.
Thanks, Tracy. So, David, I know you've had an opportunity to work in a variety of sectors. How have you gone about trying to build your understanding of these other sectors? And I think a particularly important thing that Elliot just talked about was the time and energy it really takes to really understand and really to want to understand these sectors is a critical component of this.
It is, Bob, and I think to expend that time and effort, you've got to come to this work with a sense of humility and reality that the problems that face consumers and patients and populations in healthcare today are too complex to be solved within any one sector. I think if you don't truly believe that, it's very hard to imagine creating enough time to put forth the effort that it takes to understand, the value of other sectors. But I think that, the best example in my current world today is, I negotiate or help negotiate insurance product terms for our network, and I think, as we've tried to evolve payment models away from fee-for-service to align with value, we've had to engage in a different discussion with payers, and it starts with sitting down and really understanding not only their business objectives, but their business, and understanding their financial pressures, some of their operational challenges, and sharing that information so that you kind of are able to see the world from each other's shoes. And then after that, it's building into your operational rhythm joint exercises to solution the things that have been identified as barriers to success for each organization, and try to identify the set of things that could bring value to both and ultimately to consumers. And so this gets very detailed. We have a joint venture commercial risk product with a carrier in Louisiana, and our network is the network for that. And we've had to jointly design benefits. We've had to jointly decide on how we were going to market this, how we were going to engage brokers, how we were going to handle premium structure, whether we wanted to maximize our profit or reinvest profit into benefits and keep this product affordable And this is hours and hours and hours and hours of work, but I think there's no substitute for that. And ultimately, it's caused us to really start to think like a payer, and I think it's helped them start to think a little bit about the provider needs. And so, whereas in the past we used to really struggle around asking this particular payer for data and claims data and paid claims data, now that they understand the value of that to helping us drive performance within this product, those are things we no longer bicker about. So I think this is it's incredibly rewarding work. You really can see the value of this after you've gone down this road for a bit, but there's certainly no substitute for just putting in the time from the get-go.
Great, thanks. Ira, anything you want to add before we move on to the next question?
No, I'm geared up for the next one, Bob.
Okay, you're geared up for the next one. But before we do that, we're going to ask another polling question of the participants. So why don't we go ahead and launch that?
Okay, great, Bob. I'll go ahead and do that. Okay, another few seconds and I'll close the poll. Those are interesting results, Bob.
They are interesting, and it does look like a good number of folks are trying to exercise this ecosystem mindset, which is encouraging to see. And why don't we actually, if we can go to I think we have another poll question, Trey, how aware people are. So it goes beyond the ecosystem mindset. Can we go back and do that one as well?
Yep, I'll do that right now. Okay, great. Okay, another few seconds. And this is very interesting in comparison to the last response.
So that is very interesting. So sort of a rhetorical question I'd put out to the participants is, while most of you see an ecosystem mindset as something that people try to use, most of you also believe that that your colleagues are not well informed of each other's points of views and what's important. So that's kind of an interesting contrast, and I think it does a good job of illustrating some of the tension between having an intention and actually having the capability to execute against that intention. And again, I think as you heard in the examples that were presented, that understanding is really critical to being able to generate the kinds of solutions that can really lead to a breakthrough and ultimately to generate a new solution. So why don't we, and speaking of generating a solution, why don't we go to that? Because ultimately it's great to understand, it's great to have the mindset. The question is, how do we actually go about making it happen? And so, Ira, I know you were posed for this one, so why don't you pick it up?
Sure, and I just wanted to say I had comments for David's answer, but I didn't want to take any luster off of it because it was really an elegant answer that spoke to a lot of the problems that we have. And I think maybe there'll be common themes when I talk about generating ecosystem solutions to achieve important outcomes. And the outcome I'd like to talk about as an example is the tectonic changes that we've had in the decision-making and delivery of and payment for cancer care in the United States. As many of you know, the early 90s up into 2004, there was a large footprint of community oncology, and they provided much of the infusion therapy that was cancer care treatment because they had a very good reimbursement system in an AWP minus world. When it moved to an ASP plus world in 2004, that changed it a little bit, but it was still a reasonable place to be. This went on for years. I, in 2011, was working in the medical cost category of oncology at Aetna and realized that we were seeing very significant rises in costs in hospital costs because hospital systems were consolidating, community practices were leaving and joining the hospital at their fee schedule. New and exciting biologic drugs were coming into play, and there were also advances in high-tech radiology, both diagnostic and therapeutic, in the world of radiation oncology. And so as a result, I said, okay, this is not something that can go on unless we make some progress towards changing the ecosystem. And the first thing I did was create a set of business metrics that included a picture of what was happening, at least within the customers that we served and that we could characterize financially, in terms of membership, in terms of the business objectives. So I think when you talk about ecosystem solutions, you have to take a disciplined approach and start out with what is the business problem to be solved. You cannot solve an ecosystem solution in a position in which the business you're in doesn't have a business proposition. And I don't mean that cynically. I just mean that in a practical sense, if there's no margin, there's no mission. And so ecosystem solutions take lots of buy-in and lots of organizational willpower. And so there needs to be, at the beginning, a compelling incentive from the core group. And from there, if you can motivate others and align their incentives and build stakeholders within your organization, then you can move out after that and reach out to others in like space. For example, I was able to reach out when I was at Aetna to others in the national payer space who had roles similar to the one I had as chief of staff or leading an initiative, leading the oncology solutions team. And I told them, and I said, are you having the same issues and problems? And they all said yes. A few had dipped their toes into some types of solutions, and those solutions really reflected what David said about aligning incentive and having value-based payment with clearly defined metrics and performance bonuses. But there really was not much happening in that world in the 2011 timeframe. And so, beyond that, we went to the people who would be others in the ecosystem. And then that included the provider community, both community oncologists and academic oncologists, and tried to get a feel for what were their pain points, what were problems for them. What's equally important is if you go to a stakeholder and they say, I don't have a problem, then you wonder, okay, would this be then a barrier to change because people want the system to stay the way it is? So this is all part of your surveillance step in the ecosystem solution. And then once that's done and you've tried to work within your organization, work across your industry, and then work across the ecosystem, you can then put together a premise. And the premise I put together was, can we demonstrably improve the quality and cost parameters of cancer care as per the Institute of Medicine's triple aim goals of better, smarter, more efficient care. And the takeaway that I had from doing a lot of homework and due diligence was this can be done, but only through aligning incentives and using the ability to reach out to others and try to have an executive presence to convince people that this was the right thing to do. And in doing that, I sought not to get agreement, because you'll never get, in an ecosystem scenario, agreement from everyone. It's like herding cats. But if you can get a reasonable degree of alignment where on key issues there is this aligned set of incentives, or I should say this aligned set of thought, you can get things going. And from there, we launched our first set of pay-for-value programs, and we started with Texas Oncology. And we then moved along and did other types of contracting, including when I hired a very smart, nationally known oncologist. We then moved into medical home contracting, and the ultimate ecosystem outcome of that is the CMMI-OCM. Those of you who are in the policy or oncology space, you know that the Center for Medicare and Medicaid Innovation just announced the practices. I believe there's between 170 and 170 practices in this oncology care model, which is the government's take on pay-for-value and holistic care. And it's actually modeled off of the work that, a lot of the work that we did. So I hope that's been a good example of how you generate an ecosystem solution. I will say that it takes a lot of willpower to move people, and it takes years, and it takes persistence, and you have to be, amongst anything else, besides being a good analyst, you have to be a good salesman. So I'll stop there and entertain any comments.
Great. That's a great example, Ira, and I'd like to hear from David and Elliot. And in particular, I think one of the interesting things that it gets faced in these ecosystem solutions is, as you said, you have to have a business proposition for your organization. The challenge comes when the business proposition for your organization may not be perceived as positively in some of the other stakeholder organizations. And if the first thing you go forward with is your business proposition and that is not warmly received, you have a choice to make about, do I continue? And if so, what does that look like? So, David, as you think about that perspective, I'm sure that as you've tried to work across the sectors, you've not always found that perhaps the business proposition that your organization was going in with was necessarily the one that some of the other players warmly embraced. So how have you handled that?
No, that never happened because I was always so compelling. They just aligned right.
There you go.
Yeah. No, I think this happens all the time, actually, and I think that I think you have no business proposition. There's a very difficult way to move forward. But I think hitting I'm a baseball fan, so hitting singles and doubles versus home runs can be effective. And I think in many cases these iteration solutions are very, very long-term solutions. The work is really long-term and dynamic. And so in iteration one of this work, stakeholder organizations may not generate the full business value that they might want to extract from the relationship. But these things typically evolve over time. And I'll give you the example that I had of working with this payer. So we started this work around a commercial shared savings deal. So the value for the network and for the health system was steerage. So about half the care of the population that we were responsible for was existing outside of our system. So the value for us is to create a benefit structure within a product to keep more of the patients coming to our system so that we could have the value of that. We didn't generate savings unless we were able to bend the cost curve, and that was the value proposition for the payer partner. But after a year or two of that, and after some success there, it became clear that for the network, for the provider folks, the shared saving, the amount of utilization that you had to actually reduce in order to achieve savings was worth more from a fee-for-service perspective than the savings opportunity was under the contract. And that then, would prohibit the relationship we had with the payer from proceeding. So you had to evolve the model. So we evolved to this joint venture model where the performance of the product was shared amongst the participants. So it wasn't just, it wasn't a zero-sum game anymore. It was something where we had shared financial incentives. And so I think, my answer is that frequently you don't fully align. But if you've got the right relationship and you have the right commitment and trust and you build that over time, frequently you can evolve these solutions so that each of the participating sectors continues to receive value from this work. And so, I think it's just really important to understand that these are not one and done. These are very, very long-term, dynamic, ongoing sets of work and solutions to get to value.
So going back to what Ira said, patience and persistence, take the time to build the trust, look for singles and doubles, not necessarily home runs, and be willing to evolve as new information enters the system to what your next step's going to be.
Exactly.
Okay. Great. And Elliot, I'm sure you've got a great example, and I want to, but I think we need to move to the last question, so we're going to go with that one with you. And we've already heard some of the challenges that that people are facing in this, and one of the big ones is obviously the amount of time it takes for these things to actually come to fruition. I think another one that David just referred to is a lack of trust potentially between the participants. So as you think about the challenges that you faced in operating with this kind of ecosystem mindset, how would you react to some of the ones that we've already heard, and what other ones would you point out for folks?
Well, I think I'd probably begin my remarks by picking up where others have left off. I think that one does have to be patient and have a long time horizon as you assemble partnership with individuals or groups in other sectors. Oftentimes you start out with nothing more than a plausible concept with an enormous amount of detail left to be filled in. But if the concept is compelling enough, you can bring in people from other sectors who are willing to work with you to see if it can be made real. And I think this is what David was describing in his example. I've lived through this as well. I talked earlier about our attempts to establish a strategic partnership with contract research organizations. We started out that work with just a plausible concept. We had the idea that if we planned a portfolio of studies together, that the CROs might be able to reduce the amount of idle workforce in their organizations, and that would represent an efficiency to them, and that we could capture some of that efficiency ourselves, allow us to reinvest money in other projects. So that was the idea. To get there, as I said, we have to understand the CRO's business model, and we were fortunate to identify a partner that provided us with unprecedented access to their finances. And we hired consultants who did a deep analysis and really confirmed our idea that a long-term strategic partnership could create value for both organizations. But it took a lot of work to get there, and patience, persistence, and willingness to pursue the vision. So I think that one of the obstacles you face is the notion that it's easy and it can be done quickly. It actually is quite complex, and the more participants in the ecosystem, the more complex it becomes. I think
Elliot, let me just follow on that for a minute. So very often we work in organizations that are looking for results now, not later. I don't know if you've run into that, but if you have, how have you been able to deal with that, given this long time horizon that really takes for these things to develop?
Well, you've got to choose projects that have the potential to repay the effort that you put into them. So you have to. I think you're going to be inclined to focus on large problems rather than small ones. That's okay. And I think you have to find a way to make the benefits real to each of the stakeholders. And they have to, whatever the project is, it has to provide a benefit that's tangible and you can quantify. That makes a real difference for each of the organizations. So it may be an improvement in the quality outcomes of participants in a health plan. It may be an improvement in the cost of care, or a financial improvement that allows an organization to shift funds where they're not being used productively to where they're being used productively. But you really got to find a way to characterize in a compelling way what those benefits are, and that becomes the lever that you can use to maintain support through the time that's needed to realize your vision. But it is absolutely crucial. You won't be able to maintain support if the benefits are nebulous or intangible.
Mm-hmm. Okay, and I think maybe I cut you off from some other things you were going to talk about there. Did you have anything you wanted to add around this question?
I do think parochialism is always a critical problem, and you really do have to approach these exercises with an ecosystem mindset as a leader, and recognize that if your focus is on achieving the best possible solution for your organization, is achieving the very best solution for your organization, that that may stand in the way of achieving the best possible solution for all the participants. And so driving for most substantial cost savings for your individual company or organization or sector may cause the whole collaboration to fall apart. You can't let the perfect stand in the way of the good.
Mm-hmm. Which, I mean, that's a simple statement to make. It's a hard statement to get people to execute on within an organization, because there's a tendency to want to maximize outcomes as opposed to balance or optimize outcomes, and so that is a real challenge. Okay, this has been great, and so I'm going to switch gears now and want to try to move this to the leadership model that's been developed. And what we've really tried to do with this leadership model is capture some of the things that I think you've heard in the conversations with the panelists. And clearly a key challenge in leading in this way is maintaining that long time horizon that Elliot has mentioned, while keeping things moving. And you have to keep things moving in a way that respects differences, manages the inevitable tensions that will be there between players within your own organization and with the others in the ecosystem that you're dealing with. You have to be willing to try things. You don't want to go out there until you've got a fully baked solution. You got to get in there and try things, and then learn, see what works, see what doesn't work, adapt, and all of this requires a strong focus on the purpose that you're trying to achieve, because that's one of the things that can kind of bring you back, and the opportunity that the activity is that you're trying to pursue has for not just your organization but for the broader set of players. And so that's kind of what we tried to capture in the model. So why don't we go to the next slide. And we're not going to spend a lot of time on the model here talking about, this is an iceberg if you're not clear on the artwork here. And what this is really trying to say is that the iceberg has many levels to it. There's what we see above the surface, and a lot of those happen to be the skills, some of the knowledge, some of the understanding, the intellectual understanding about what the different sectors are about, as well as the basic understanding of what they're trying to accomplish. So those are important, and we heard some things talking about that, but we also heard more in the comments about some of these other things that are below the line, the things that really determine whether or not you are able to overcome kind of an parochial approach, or take a long-term kind of a view, or be able to look at not maximizing but optimizing. And so the model really tries to deal with some of those below the line things more than the above the line, but I certainly don't want to minimize the importance of the above the waterline items as well. So let's take a look at the below the waterline model that we have here. And so you can see it's been divided into four quadrants here, and kind of moving from the upper left and going around. The first is you got to have a picture of where you're going, and I think we heard this from all of our panelists. And it very often begins with this very much of this what if kind of an approach. What if we were able to reach out to, if you're a provider, to payers? What if we were able to reach out to a safety net? What if we were able to reach out to educational institutions? What could we do that would improve the health of the populations that we take care of? And so really using that kind of an approach allows you to imagine potential solutions that you might not otherwise imagine. But then you need to, as you reach out, you begin to develop solutions and evolve those solutions as other players come into the party. And the future that you envision shifts and changes as you bring other people in. And so this is not a one and done kind of a here's where we're headed, but it's very much an issue of being able to adapt as new players come in, as new inputs come in, as new interests come to the table. And so that's a critical starting point, and it is a centering point as you run into some of the difficulties of moving forward. And moving around to the next quadrant here, you've got to align all these different stakeholders, obviously. And that includes bringing them into the what if envisioned future and allowing them to begin to broaden it and have input to that so that they feel some ownership for it. It's not just them buying into what you want, it's them contributing to and developing something together. You've got to take the time to build the relationships. David, for example, talked about the trust. If you don't have the trust there, then you're not going to move forward. And sometimes that means just finding opportunities to talk without a particular objective in mind beyond getting to know each other, getting to understand each other better and build those relationships. Because if you try to move forward at a pace that is out of sync with the trust that you built, you're going to continue to run into significant bumps. And in doing that, you've got to recognize diverse perspectives and really take the time to understand why people feel the way they do, why their interests are what they are, why the problem is what it is, and think about how to work with those differences. And you've got to create forums to encourage dialogues across stakeholders. And again, I think you heard some examples of that from our panelists where they brought together different stakeholders in order for them to dialogue with each other. And so really taking the time to build that coalition of stakeholders in support of and in adapting the vision become important actions and behaviors that a leader needs to be able to demonstrate. And then as you begin to work with those stakeholders, moving down to the next quadrant here, you're going to run into problems. And obviously you have to expect those problems to be there. And as you hit those bumps, some of which may be larger than others, it's important to try to continue to focus on the opportunity. Why are we here? Why are we doing this? Why am I taking the time and the effort to engage with these folks who think so differently than I do or have different agendas than perhaps I do? And you've got to effectively find ways to resolve those tension points, to figure out where do we actually connect. Where are the critical places where we've got to be able to work together effectively? It may not be on all things, but what are the ones that are going to make the work we're trying to accomplish here most successful? And where does it become unclear about who's doing what? And bring those things up bring those conversations forward and really try to work things through. And this, again, this is going to be a continuing cycle. This is not, you do step 1, then step 2, and then step 3. And then finally, as you're able to generate ideas, these singles that we refer to, you've got to act. Even though you may not feel like you've got all your ducks in a row, you've got to take the steps that are necessary to advance the vision. You've got to do that with the other stakeholders, and then you've got to expect that you're going to learn things about what worked and what didn't work, and that can be from the standpoint of moving the ball forward, or it could be a stakeholder finding like, I didn't know that's what you meant. If I had known that's what you meant, I probably wouldn't have agreed. So you've got to use that and work that back to managing the boundaries and the obstacles. So it is a very ongoing kind of an approach that when you get down to ultimately the kind of mind frame that you need to have in order to exhibit these behaviors, there's got to be tremendous learning agility. You've got to have a curiosity about other things, about other ways of doing things. You've got to have a humility around your approach. And the term that everybody talks about these days really applies here, and that's the emotional intelligence. First of all, you've got to be aware of your own reactions to what's going on around the table. And when you start to tighten up when somebody puts a point of view together, you've got to be aware of that and what's the trigger for that. And you've got to be able to effectively manage that and still approach the individual and try to understand more about what was important to them and why are they doing what they're doing, or why are they thinking what they're thinking. So it requires an awful lot of emotional intelligence, control, awareness, empathy for the other points of view in order to exhibit the behaviors that are outlined up top. And then clearly it requires a long-term focus. It requires a mindset toward creating new solutions versus winning the battle. So again, this whole idea of maximizing. And all of this, is a lot harder to do as you engage more and more stakeholders with more and more different points of view than perhaps it sounds. This takes a lot of work, it takes a lot of effort, and it takes a lot of development to really manage these kinds of interactions. And hopefully this model, resonates with those of you who are on the call today, and hopefully it does a good job of capturing the kinds of things that you heard from David and Ira and Elliot as they've talked about some of the things that they've tried to accomplish. And again, keep in mind that all this is happening in the context of not just a given organization or multiple organizations within a given sector. These are trying to be exercised across sectors where you have providers and payers and pharma companies and community agencies and regulators and local government all trying to work together around some common purpose. So that's really what adds to the complexity of exercising and demonstrating these capabilities. And so we're going to make a transition here, and I think before we do that, Tracy's got another poll question, and then we're going to kind of move this thing down the home stretch.
That's right. As we enter the home stretch, one last polling question for our participants. Okay. Okay, a couple more seconds and I'll close the poll. Also, I think encouraging results from our participants, even being moderately prepared for leading with these competencies today is quite impressive. I couldn't help but think, Bob, as you're reviewing the model for the new leader in the new healthcare ecosystem, if we only had these types of leaders managing government, we wouldn't be looking at this comedy show that's going on right now. And by the way, I'm not taking any sides. I'm just saying it's been very comedic, but it does require individuals to be able to really walk across that aisle, the aisle being different sectors within the healthcare ecosystem. And as we start to think about moving leaders from their organizational focus to their sector focus to cross-sector focus, it really does require a much more strategic perspective and I think a deeper understanding of self and the way the self is exposed to and manages relationships with others. You mentioned emotional intelligence being one of those things. So I do want to spend just a little bit of time as we come down this home stretch to talk about how we move forward. There's a bit of encouraging news out there. Recently, there was a joint study published by the AON, which is the American Organization of Nurse Executives, the AAPL, American Association of Physician Leaders, American Hospital Association, and the American College of Graduate Medical Education, and this would be in the provider subsector, where they looked across the sector to think about what are the leadership competencies that are going to be required for population health within that sector. So obviously there's a focus now on coordination and collaboration. Where we need to take this to, however, as we think about communities and health communities and population health management, is to start to align across the sectors. And based upon the great input of Bob and the panelists, Elliot, Ira, and David, what we learned today is that there are challenges and opportunities of leading healthcare organizations, and those challenges and opportunities are just going to continue to grow. Things like consumer centricity, reducing the total cost of care, optimizing value, enhancing coverage, and improving population health, they're all widely recognized needs. The complex problems require really innovative solutions, and effective and unique collaborations across these sectors will be what's going to enable success. And because these collaborations will bring together groups that are diverse in purpose and values and perspective and incentives, as Bob talked about earlier, leadership is really what's going to be key to progress and outcomes. We believe that leaders who can demonstrate the competencies that Bob reviewed in the Helm model will be much more competitive, and they'll be able to produce better results, not only for their organizations, but for populations, communities, patients. And we know that these competencies are developable. So while only some roles on a senior leadership team will have significant responsibilities for leading efforts across the healthcare ecosystem, the capabilities of leaders in those roles are critical. Organizations really do need to start to identify which roles are pivotal success in creating solutions across the ecosystem, and then assure that the right leaders are prepared and placed in those roles. So how do we do this? I mean, what do we know from the work that we do around aligning talent to strategy? We would suggest that organizations be very clear about which roles will be required to demonstrate these mindsets and capabilities, and then have current leaders assessed against them, assessed against this model to determine their capacity for developing the competencies. We're confident that leaders can develop these capabilities with targeted development solutions. There's a variety of them. There's coaching and mentoring and action learning and business simulation type projects. There's inter and intra-sector job experiences. There's coming to webinars like these where you can initially learn about the competencies. And of course, when there are immediate vulnerabilities in an organization, we would recommend that you seek to hire external resources that have the new knowledge, have the new leadership competencies and the viewpoints to take an organization from its individual sector perspective to one that is more ecosystem friendly. So those are our initial thoughts about how we do indeed move forward and how we begin to enable leaders and companies, organizations, industries to start thinking differently about the way in which we lead. So with that as a backdrop, and with I guess we've got about 10 minutes left on the call, I do want to just thank our panelists and Bob, of course, for this incredibly interactive dialogue that we had today. Thank you for your time, for your preparation in terms of the webinar, and for the model itself, Bob. I think it's really innovative. And we sincerely appreciate all of you, our participants, joining us today. We'll be following up with the presentation and a short survey to garner your feedback. And before we close out, I will just pause and ask if Bob, if you, Elliot, David, or Ira have any last words of wisdom to leave our participants with.
This is Ira, Tracy. There was one thing I wanted to say in conclusion, which is that we spoke a lot about the challenges and the arduous and long work that is ahead of someone who wants to take on the challenge of creating an ecosystem solution that has real impact on society. And it sounded like a lot of doom and gloom because, as David said, go out and you hit a few singles here and you're not sure whether you're really getting to goal, and there's a lot of people who may not be aligned with you and there's conflict. But I would just say that I think it's a privilege to have the ability to make impactful change on something as important as healthcare. And so, I always think about when I was junior faculty in a medical school. I was an assistant professor and I was running around the hospital, and I was frustrated that I thought the EMR was terrible. I thought my consultants weren't fast enough. I wasn't always satisfied with the competency of my colleagues. And now I actually have the ability to make significant changes, or at least try. And I think anyone who's taking a leadership position should feel that joy as well, because it's a privilege to be able to be in a position to do things that matter.
Yeah, and this is David. I'd like to pick up. That's a great, it's a very inspiring point, and it's kind of what I was thinking about was something that's somewhat similar in that, you go back to the first couple of slides where we saw the picture of the tsunami, that is the challenge of healthcare. I mean, we've got real big problems facing our country in healthcare, and I think for each of us who choose to work in industries or in sectors within the healthcare ecosystem, we all have to ask ourselves as individuals and as leaders in these companies, do we want to be part of a solution, or do you want to be part of the problem? Because really you can't be both. You either will contribute to the continued challenges of the healthcare ecosystem, or you'll be part of the solution. And for those who choose to be part of a solution, this style of leadership is critical to the success that we've all spoken about today. So, I think this is a tremendous opportunity for organizations to identify leaders, groom leaders with these types of skills and this type of vision to really bring around change, the type of change that I think we scream for and that we yearn for in the United States these days. So, real honor to be here and participate today, and I hope this is inspiring to those who are on the call to kind of continue to get this message out and to move this form of leadership forward.
Thank you. Thank you, Ira. Thank you, David, very, very much for your concluding comments. I think you hit the nail on the head. We are very lucky to be working within an ecosystem that is devoted to helping people live healthier lives, and we ought not lose sight of that, that we're all here for the same end goal. And only collaboration and great communication and great leadership is going to get us to that end. So thank you. Great concluding comments. And again, I do want to thank Bob very, very much for your work on the model, for your ability to moderate a great discussion. And of course, to Elliot and Ira and David, thank you so much for your insights and sharing of stories of both challenges and uplifting opportunities ahead. So thanks to all, and I hope you enjoy the remainder of your day, and happy to give back the gift of 6 minutes.
Thanks, Tracy.
Thank
Thanks, everybody.
you. Okay, bye-bye.